I don't know what it is about me. I click with children. They will come to me and I will just embrace them. I'm from Kumasi. Kumasi is the second largest city in Ghana. I'm an Ashanti. That's my tribe. The food we eat is fufu. Our cultural dance is called adowa. We do wear mostly our kente. That's what I'm wearing right here, is kente. We are really proud of it.
There are an estimated 178,000 Ghanaian immigrants living in the U.S. New York State has the largest population of immigrants from Ghana, and the Bronx heads the top 5 counties where Ghanaians now reside in the U.S.
I'm going to make some tea. I have a child, a 9-year-old child that I have to take him to school. So I get up latest by 6 o'clock, get his uniforms and stuff ready. I wake him up at 6:20. He gets himself ready, get him breakfast, make his lunch, and take him to school. Come back upstairs, get my tea, pick up my stuff, and I hit the road. Usually when I'm going to the office, it's really hard to find a parking in that area, so I leave early. So latest by 8 o'clock, I hit the road. Oh, it's 8:02. I have to go. Bye, Mom.
Mary's one of those people that you can learn a lot from. If you sit with her during her sessions, it gives you a lot of ideas that you can use for your own sessions. Parents have said that, Mary came into our house and she changed our lives for the better. She's just good at what she does.
Getting to the friend's office from my home is like between 20 to 25 minutes drive without traffic. But sometimes it takes me over an hour to get there. So it depends on the day. In this rain, it's not helping at all. I've been with VNS Health, HBCI Bronx team for 13 months now. We service children from 5 years up to 17 and a half. We go to their homes to teach them coping skills about whatever they're going through, being anxiety, depression, loss. The program is a very short-term program. It lasts 4 weeks. And sometimes we can extend the cases to 6 weeks. I'm glad to be part of this team, helping children. Before this, I didn't know children go through a lot of mental issues. I thought children doesn't have problems because you have parents, you have caretakers, you don't have bills to pay. But working with HBCI made me aware that a lot of things that people go through during their old age start from when they are children. Some children go through a lot of trauma. Things happen in their life and it gives them like PTSD. They get anxiety, they get depressed. So it makes them put up a behavior that is inappropriate. Mostly we get our referrals from schools due to children's behavior or statements that they make. And after the pandemic, it's been worse because most kids cannot stay in school for 6 hours without playing video games. So they'll be like, if I don't get a chance to play my video games, I will kill myself. I don't want to be here anymore. I will burn the school. They make a lot of statements like that. So then they will send them to the emergency psychiatric ward. They cannot keep them there forever. They have to let them come home, but come up with a plan and get them services that can help them to regulate their behavior. So that is what we do. We are here at the Friends office for the HBCI team meeting.
happy Wednesday. Let's start our team meeting. Hi, I'm Helena Tenkorang. I'm a program coordinator for the Home-Based Crisis Intervention Program, and I'm from Ghana. What I love about working in this community is that I'm able to educate the African community more about mental health.
My name is Zamansky Twum. I'm currently a social work assistant for the Home-Based Crisis Intervention Program here at VNS Health. I was born and raised in the South Bronx. My parents immigrated from Ghana to America, so I'm a first-generation Ghanaian American.
We're really lucky to have Mary and Zamansky on our team because they share the same culture background with the families we serve. So with our team meetings, we talk about cases that we have and ways that as a team we'll be able to help our clients.
Everyone in our team has the same goal, and that is just to provide the best service we can to the children in the Bronx. When it comes to the African community, they don't believe that mental health is a real thing. They associate what we would call panic attacks or mania with spiritual things that we can't see with our eyes, like with the devil, when in reality it's triggered by the things that surround them.
When we go to a home and observe that the family is not receptive to our services or receptive to mental health, we validate their feelings and we give them like a rest assured and say, look, we're Africans, we're social workers, and we're here to help. So that alone helps a lot. Team, happy Wednesday. Our meeting is done.
I am excited to be part of the team that help people, especially young children, but sometimes it's challenging because you don't know what the day have for you, or sometimes you know what you're going to face. Today is a bit challenging because of something that went on last week. I had to hospitalize one of my clients that she specifically told me, this thing that you are doing is going to break the relationship that we built. But I didn't have a choice. I was more concerned about her safety. Since that day, she doesn't want to talk to me, even on the phone. She doesn't want to see me. It hurt because I spent like 6 weeks with her. It's been a lot of progress. And all of a sudden, the relationship broke. We struggled to get her a psychiatrist, places that they would take her insurance. It's like 4 or 5 months waiting period. And we had an appointment for her for yesterday. Because of what happened, she refused to go to see the doctor yesterday. So today, I'm going to go to the house. Due to safety concerns, I would like one of my co-workers, Zamansky Twum, to be my buddy for the session today.
So today I'm going to join Mary for support and help the child see things from Mary's perspective and possibly help Mary see things from the client's perspective as well. It feels good to be able to go together as a team to conduct sessions because it ensures safety. It also helps with being able to see things from different lenses. I suggest you just remind her that her life is precious and what she does with it matters. Even though it seems like the situation that she's in may never change, it can change. It's just how much work she's willing to put in and just taking the treatment and being open to trying new things.
I do understand what you were saying. I think maybe she's tired of listening to me. So when we get to the home, maybe I'll let you explain it to her.
Okay.
Thank you.
You're welcome.
Hopefully it goes well, and then it will be a successful day.
I hope so too.
Good evening. Are you home? Okay. I haven't seen her for a while, so I want to see her and check on her. I'll be coming in with one of my co-workers. All right.
The home-based crisis intervention team, they're really rocking it out there, and we're seeing success.
So we went in the house and we saw the client trying to dodge us. And then she eventually came, sat down, talked to us, expressed how she felt, listened to Mary and I. And at the end, she was open to the suggestions that Mary made.
Thank you so much for your help. It really made a change. You can see she's still holding something against me, but I think the relationship is coming back.
It's coming back.
Yes, tomorrow is another day. I'm going to drop you off home and I'll see you tomorrow.
Thank you.
You're welcome.
We're great, aren't we?
Yes.
At the end of the day, I started to think about, for the longest, the Bronx has been one of those places that have kind of been forgotten when it comes to mental health. Children are going through it, adults are going through it, and sometimes it gets to a point where people don't know where to turn. They get to a point where they feel hopeless. So it's important for us to do our part to help the children of the Bronx and their families understand that they've not been forgotten and that there's hope for them. And what happened yesterday doesn't deter them from the success that they can reach tomorrow. That keeps me going.
Sometimes you'll be closing a case and you feel like, oh my God, I didn't reach my goals, or I couldn't make the impact that I wanted to make on the client. But you let them go, you feel like, oh, they wasn't listening, they weren't paying attention. But trust me, most of them, when you do the follow-up, they will progress. When we hear something like that, it makes us so happy. I want to do more, learn more, help a lot of children, and bring the awareness to my community, my African community, not only Ghanaian communities, to the African communities, for them to know more, to pay more attention to their children's mental health.
Me,
Yes, yes I am. Did you miss me?
Yes.
This is why I do what I do. Thank you guys for spending the day with me. Bye-bye and have a good night.